Colin Campbell, The China Study, the most comprehensive study of nutrition ever conducted and the startling implications for diet, weight loss, and long-term health. Embark on a journey that unravels the significance of nutrition in the quest for good health, as The China Study presents groundbreaking research highlighting the impact of diet on various diseases. This comprehensive examination of nutrition transcends the traditional focus on medicine and delves deeper into the transformative power of a plant-based diet. Discover the surprising truth about protein consumption, the nexus between animal-based protein and cancer, and how a plant-based diet can prevent and even reverse certain health issues. This summary encapsulates the key findings and their implications for crafting a healthier lifestyle based on informed dietary choices.
Redefining health. Medicine isn't the solution to good health, a balanced diet is. Medicine has been advancing rapidly in the recent past, yet people are suffering from illnesses all the time. The reason behind this is the misconception that medical care can cure all our ailments. Modern medicine has not been able to establish precise solutions for complicated illnesses like carcinogenesis. Moreover, focusing on increasing healthcare investment does not necessarily translate into better health outcomes. The American health condition has worsened over the years despite the increase in healthcare spending. The pharmaceutical industry's over-reliance on medicine has yielded severe side effects, with 7% of hospital patients suffering from severe side effects or dying from overdoses. The solution to staying healthy is maintaining a balanced diet. Nutrition is crucial to overall good health, not expensive medical cures or complex surgeries. Maintaining a healthy diet can help prevent illnesses like heart disease, cancer, and diabetes. It's important to realize what constitutes a healthy diet to make a positive impact on our well-being. Rethinking protein consumption. We commonly believe that we need a lot of protein in our diets. However, the truth is that we need much less than we think we do. German nutritionist Karl Voigt determined in the 19th century that we need no more than 48 grams of protein daily. Despite this, Voigt recommended eating 118 grams of protein per day, which has influenced the belief that we need more protein. Research has shown that a diet rich in animal proteins can be a catalyst toward developing cancer. In contrast, plant-based sources of protein such as beans, nuts, and soy do not carry the same ill health effects that meat and other animal proteins do. The China Study and its groundbreaking research. In collaboration with the Chinese government, researchers from Cornell University and the University of Oxford conducted the China Study, marking one of the largest public health studies ever conducted. The research aimed to examine how environmental and nutritional factors impacted overall health. By studying genetically homogeneous individuals, but who experience varied illnesses in different regions of China, the researchers were able to explore the connection between environment, diet, and specific diseases. The China Study analyzed large data sets and conducted experiments in 60 different regions of China. This analysis provided an opportunity to determine how different types of protein, from plant-based to animal-based, correlated with specific diseases. Ultimately, the China Study findings were combined with the Cancer Atlas data, which was established by the Chinese government series of cancer studies. The results revealed a strong correlation between diet and disease, including various cancers and heart diseases. Protein and cancer. A low-protein diet can prevent cancerous cells from developing in the body, according to the results of the China Study. Enzyme activity is decreased by a low-protein diet, which makes it less likely for cells to turn into cancerous cells even when exposed to carcinogens. The number and size of foci, which is a precursor to full-blown tumors, is determined primarily by protein intake and not the presence of carcinogens. High-protein animal-based diets were linked to triple foci growth in rats compared to low-protein diets. Furthermore, animals exposed to low doses of aflatoxin yet consumed high levels of animal proteins developed more tumors than animals that were exposed to high amounts of aflatoxin but consumed a low-protein diet. The study found that the consumption of plant proteins didn't promote cancer growth. The health benefits of a plant-based diet. It has been discovered through groundbreaking studies that diets high in animal protein can lead to cancer, while diets containing plant proteins can prevent it. To reduce the risk of cancer and other health problems, maintaining a plant-based diet is recommended. Animal products, such as milk and butter, have high fat content and can increase estrogen levels in women, putting them at risk for breast cancer. Studies found that low-fat, high-fiber diets, which are mostly plant-based, are associated with reduced instances of colon and rectal cancer. Chinese women who consume a diet low in animal protein and fat have a lower risk of developing breast cancer, and the average Chinese person has a healthy daily intake of 33 grams of fiber. Plant-based foods are also rich in antioxidants, which combat free radicals that can damage cells and cause vision problems. Therefore, it is best to replace animal products with plant-based options to maintain optimal health and reduce the risk of illness.
In conclusion, the China study reinforces the potent influence of nutrition in determining our overall health. The research discloses startling revelations surrounding animal-based proteins and their link to cancer, while also advocating the multiple benefits of plant-based diets in preventing and combating various diseases. By embracing a plant-based lifestyle, one not only minimizes exposure to health risks but also promotes long-term well-being. This summary equips you with the essential knowledge and understanding necessary to make informed choices and prioritize nutrition as the primary pillar of a healthy life, free from the limitations and drawbacks of conventional medicine.